Dr. ABC, narrated by Taylor and Andrea.
Today we will be sharing with you the steps of CPR.
Learning CPR is as easy as remembering Dr. ABC. ABC is an acronym to help you remember the important first steps before performing CPR: airway, breathing, and circulation. So open the airway, check the victim's breathing, and pulse.
Before attending to someone in need, maintain your safety. Check for situational danger such as oncoming cars, exposed electrical wires, and attackers still present, etc.
Check for a response from the person by shaking them, asking them if they are okay, or stern tapping them if necessary. If there is no response, call out for help and dial 911 immediately.
Once the scene is safe, begin the A step in ABC by opening the airway. Lay the person on their back. Check the person's airway, making sure there is no obstruction, like a swallowed object, vomit, or mucus. If an obstruction is present, open the mouth by grasping the tongue and lower jaw between the thumb and fingers. Lift and sweep with the index finger in a hooking motion deeply into the mouth at the base of the tongue to remove the foreign object from the throat.
If no object is present, open the victim's airway by lifting the chin carefully. This will move the jaw forward and tilt the head backwards, allowing a path for air to travel to the lungs from the mouth and nose. Remember, don't push the forehead back in an effort to open the airway. If the victim has a neck or spinal injury, this will only make it worse.
Once the airway is open, check for breathing by looking for rise and fall of the chest, listening to sounds of breathing, feeling for breath on your hand or cheek for 3 to 5 seconds.
To check for breathing, watch the victim's chest. If you can see it rise and fall even slightly, then they are breathing.
Whether or not you can see the chest rise and fall, listen with your ear to the mouth and nose. You are listening for breathing sounds.
If the person is not breathing, provide 2 rescue breaths by tilting their head back while lifting their chin. Watch the chest. If the chest does not rise and fall after 2 breaths, retilt the head, lift the chin up, and try again.
If spontaneous breathing does not commence after rescue breaths, check for circulation. To check circulation, feel for a pulse for 5 to 10 seconds. Press 2 fingers gently on the victim's neck between the Adam's apple and the muscle and the side of the neck. Do not use your thumb because your thumb has a pulse of its own. If a pulse can be felt, do not start chest compressions. Recheck for breathing, restart rescue breathing, continue 1 breath every 5 seconds.
If no pulse is felt, then start chest compressions immediately by following the rib cage to where it meets the center of the lower part of the chest, or in between the nipples in men. Place the entire heel of the hand 1 to 2 finger widths above the lower tip of the breastbone and place the heel in the middle of the chest.
Straighten your arm, lock elbow, and push straight down on the chest about 1/3 of the depth of the chest 30 times, and let the chest relax completely between downstrokes without removing hand from chest.
Tilt the head back, lift the chin, pinch the nose, and give 2 slow, full breaths. Alternate 30 compressions and 2 breaths for 4 cycles, or 2 minutes. Allow 4 cycles and then check for a pulse.
If there is still no pulse or you are unsure, continue chest compressions until help arrives or the person starts breathing on their own.
If the person starts breathing spontaneously or regains consciousness, place the person on their side in a recovery position and wait until help arrives.
Now that you know how to do CPR, remember the steps with Dr. ABC. D for danger, R for response, A for airway, B for breathing, and C for circulation.